You smoke?
Why?
Cigarette smoke constricts the blood vessels.
Constrict. Constrict.
Cigarette smoke constricts the blood vessels. You smoke?
Why?
Cigarette smoke constricts the blood vessels. I've seen really good grafts fail over a few cigarettes.
Graft. Graft.
I've seen really good grafts fail over a few cigarettes.
Well, I don't smoke, so...
Really? Just judging by the nicotine stains your fingers do.
Nicotine. Nicotine.
Really? Just judging by the nicotine stains your fingers do.
She had hip replacement surgery a month ago and was discharged last week.
Then why is she still here?
Because I am not a bouncer and this is not a nightclub.
Bouncer. Bouncer.
Because I am not a bouncer and this is not a nightclub.
Mrs. Larson's got to go.
But if she refuses to leave, what can I do?
She's 78 and non-ambulatory. You have the upper hand here. Use it.
Ambulatory. Ambulatory.
She's 78 and non-ambulatory. You have the upper hand here. Use it.
Oh, thank you. Thank you.
Okay, Miss Larson, I'm Dr. O'Malley.
Oh, an Irishman. I love the Irish. They have a sparkle.
Sparkle. Sparkle.
I love the Irish. They have a sparkle.
She was given 50 chlorpromazine, which stopped them for a while, but then the hiccups returned. So she needs a surgical consult to rule out esophageal perforation.
Perforation. Perforation.
Rule out esophageal perforation.
She doesn't speak English.
Are you her boyfriend?
Her coach.
Oh, she's an athlete.
Oh, Yumi's a competitive eater.
Eater. Eater.
Oh, she's an athlete.
Oh, Yumi's a competitive eater. She wonders how a wrestler got smart enough to be a doctor. Most wrestlers she knows are dumb.
Wrestler. Wrestler.
Most wrestlers she knows are dumb.
Surprised to see you back again so soon. Pig Vab usually holds up 10 to 15 years, but yours seems to be degenerating a little too quickly for my comfort.
Degenerate. Degenerate.
Yours seems to be degenerating a little too quickly for my comfort. There's an underlying cause for your wife's valve failure that remains undiagnosed. Theory's great.
Rheumatic fever, chronic use of migraine meds.
Rheumatic. Rheumatic.
Rheumatic fever, chronic use of migraine meds.
Dan, a little harsh in there.
He was lying. Besides, your harsh is another man's refreshing.
Refresh. Refresh.
He was lying. Besides, your harsh is another man's refreshing.
But some other service?
I'm the chief, O'Malley. I can't condone turfing patients onto other services.
Condone. Condone.
I do the services.
You're not moving out, George.
Oh, yes, I am. I gave an ultimatum. Threw down the gauntlet. I drew my line in the sand.
Gauntlet. Gauntlet.
I gave an ultimatum. Threw down the gauntlet. I drew my line in the sand.
Okay. What are you doing?
Oh, it's a flyer.
Izzy, come on! Oh,
Flyer. Flyer.
Oh, it's a flyer.
Izzy, come on!
Oh, surgical floor has become a dumping ground for patients who aren't even surgical. We are overworked and exhausted. This makes for...
Overwork. Overwork.
We are overworked and exhausted. This makes for surgical arrogance.
Not arrogant.
You're killing them with that workload. Look at the board.
Workload. Workload.
You're killing them with that workload. Look at the board.
Say boxing.
I see.
Hiccup. Hiccup.
I see.
That nice lady doctor in gynecology said that since I had a hysterectomy back in 74.
Hysterectomy. Hysterectomy.
Said that since I had a hysterectomy back in 74. Said that since I had a hysterectomy back in 74, I don't have a uterus to prolapse.
Prolapse. Prolapse.
I don't have a uterus to prolapse. It must be one hell of a dog.
Mrs. Klein's talk screen and titer both came back negative.
Tighter. Tighter.
Mrs. Klein's talk screen and titer both came back negative. Stop with the lying.
You're being honest? The last time you called him McDreamy, you were all at Twitter with love.
Twitter. Twitter.
The last time you called him McDreamy, you were all at Twitter with love.
That's now a virus? Are you kidding me?
No, look at her. She's feverish. She's much weaker than she was this morning. She could be decompensating.
Feverish. Feverish.
She's feverish. She's much weaker than she was this morning. She could be decompensating.
Complications of Borhave syndrome. Go.
Pleural effusion, sepsis, shock.
Sepsis. Sepsis.
Pleural effusion, sepsis, shock.
Dr. Karev, how do I begin the esophagomyotomy?
Cut proximal and distal to the tear to expose the mucosal defect.
Proximal. Proximal.
Cut proximal and distal to the tear to expose the mucosal defect.
Why didn't you call me sooner? All right, let's get out of here.
I was gonna fashion a gastric patch.
I taught you the procedure.
Gastric. Gastric.
I was gonna fashion a gastric patch.
I taught you the procedure. Dr. Gray, you took a detailed history. When did Mrs. Klein develop asthma?
Klein. Klein.
When did Mrs. Klein develop asthma? It masks itself as a bunch of seemingly unrelated symptoms. Adult onset asthma, valve failure.
An increased level of serotonin in the blood.
Serotonin. Serotonin.
An increased level of serotonin in the blood.
Adult onset asthma, valve failure.
An increased level of serotonin in the blood.
Which creates a false sense of euphoria.
Euphoria. Euphoria.
Which creates a false sense of euphoria.
How exactly is that possible?
She wouldn't leave.
My mother is old and infirm. You couldn't make her leave?
Infirm. Infirm.
My mother is old and infirm. You couldn't make her leave?
You fight for what's yours.
Winch. Winch.
Now that, my friend, is a swagger.
Swagger. Swagger.
Now that, my friend, is a swagger.
Do you have any idea what a sick-out would do to this hospital?
I've already put in the call for temps.
What's this?
Official notification.
Notification. Notification.
What's this?
Official notification.
I'm George. I sleep down the hall from you. I buy your tampons.
Tampon. Tampon.
I buy your tampons.